In Michigan, more than 650,000 residents rely on a health center as their primary medical home to receive comprehensive and preventive healthcare services at more than 260 delivery sites. Health centers are located in medically underserved communities and provide primary and preventive health care to individuals who are low income, uninsured and underinsured, the elderly and minority populations, homeless individuals, residents living with HIV, the LGBTQ population, veterans, and migrant agricultural workers.
Many of the community health centers that have come up didn't come up because somebody decided they wanted to put a community health center there. It came up because there was a need in that community.
Our clinics serve top-level executives. We serve law enforcement. We serve public officials. We serve the average county employee. We serve school employees. And we serve the homeless people in our community. So we are non-discriminators in the level of care that we provide.
It's kind of the old adage, if you don't pay me now, you're going to pay me later. So it's all those kinds of issues related to making sure that we are able to provide that preventive care as soon as possible.
Health centers offer this innovative model of care at a lower cost to patients than other providers and accept patients regardless of insurance status.
We have a lady here named Jackie that has helped a lot of people in this community just have access to health care. That is so important. We used to see a lot of uninsured, so that was kind of a big barrier. So now that we do able to have access to health care, that is such a big thing.
The problem for them is to understand their health care, to understand how to get the insurance, to know where to get the insurance, and once they get it, how to maintain it.
Health centers are a reflection of their community. No two are just alike, as their services are tailored to meet the needs of the community. Patient involvement is key to the health center's success. Governing boards, comprised of a minimum 51% health center patients, manage health center operations. This unique structure allows the patient to provide input and make decisions on services provided.
We have a first-class clinic that we expanded, but also give the people a beacon that they can come to this facility and have the services that they deserve. I've been coming here approximately about 5 years. And again, they check my cholesterol, blood work, and all these different things. And I never had a problem. They let me know that I was borderline diabetic, borderline high blood pressure, and they work with me. Sometimes they threaten me. But the bottom line was they wanted to make sure that my health was top notch.
The more we can do with our services to support people in the social determinants of health, the kinds of things, and this doesn't relate to poverty. This is a simple solution in a community where having access to and teaching people to select the most nutritious food when they go to the grocery store makes a big difference in health outcomes in the long run.
Health centers operate as comprehensive medical homes, providing medical, dental, behavioral, pharmacy, laboratory, and OB/GYN services under one roof. School-based health centers have professionally trained healthcare teams who work to provide primary and preventive health services to individuals and families.
We know that we make a difference with the services that we provide. It's not just about the clinical, it's about prevention, and then the aspect of just taking those youth under your wings and instilling again the hope. Many times kids are coming from many types of environments that some of us have been fortunate enough not to experience. And so for them to have a trusting adult in their life has been very, very impactful.
Every day here is wonderful. They come here, I like them to feel that they're cared for, supported, and loved, and they feel it. And when they feel that, that gives them the comfort to open up to other issues that we would have never gotten to if we didn't, break down that barrier.
A lot of the students are just stressed and they feel like they're not in charge of their life. They feel like, I don't know what the future holds, and I feel like just having someone there to listen to you and all of your fears and your troubles really just encourages you to kind of find yourself and know who you are in the future and just kind of have that hope I feel like that's what we have here and within the TC and the health center.
I don't want anybody to worry about how they're going to pay for things. Just come in, we'll worry about that later. We're here and we're ready to take care of you and also to direct you into other areas that you may need. All our centers are strategically placed for public transportation, so we're trying to build the nicest health centers, but still make it available to the population, be it where they live or be it where they can get here.
We try to treat you like family, so from the time you walk through the door to the time you leave, you should have a wonderful experience.